Okay. Good, no, after all these years, wet hands and gloves do not fix. What is going on here? All right. So I'm going to have you move your pencil just a little bit more. You're going to be in your neighborhood here. So oftentimes when you have these patients, you have to do either pelvics on them or bladders. You have to get a little bit lower than you think. And so you don't want to perv your patients out. So what I'll usually end up doing is kind of putting my hand under the waistband and then lifting it up so I can get to where I need to go. Oh, look at that. Okay. So let me tune you down a little bit. So we are used to, where's aorta distal? Somewhere in here. So we're used to seeing kind of iliacs, aorta distal coming down. So notice I'm going to rock my transducer inferiorly. I'm not really sliding, I'm just rocking. And then this is her pubic symphysis. So it's very bright. We've got this nice big shadow. And our post void, if we can't see a urinary bladder, that's our landmark to say, hey, we're there, we just don't see a bladder. So that's going to be your landmark. And she can probably tell you I'm pretty low on you, right? Mm-hmm. Yeah. Just make sure you're not like peeking around or sticking your hands in there or anything like that. Sag, UV. All right, so our first image, we're gonna go ahead and clean this up a little bit. This is uterus. You guys won't need to worry about this. Vaginal canal, cervix, up to uterus. We're seeing a little bit of endometrium. But we're really gonna just focus on this urinary bladder. See that there. All right, so we're gonna sweep through for pathology from one side to the other, making sure there's no hairy scaries going on. Looking pretty good. And there's an iliac out here. So kind of where our largest width is, or largest length. So we're going to save this image. Now, we're going to do a, oh wow, it's fine. We want to do a volume, right? You know how to calculate volume? Length times width times height times 0.523. Or you can push the calculation button and go to volume. So we can go volume calc. It's going to ask me about diameter 1. Yes, I want diameter 1. So we're going to go from here to here. So kind of the longest length across that bladder. I'm just going to get it off. And then to save this, I can either push enter here or I can double click down here. I'm a double clicker just because it's easier. And then we'll save that. So once it turns white, you know that measurement's been saved. Otherwise, you go to measure diameter 2 and it's like, there's no diameter 1. Who are you talking about? So there's our first 2 images of the bladder protocol. Next up, we're going to go transverse. So switching to transverse. And so here we are in transverse. We've got vaginal canal coming into cervix, going into the uterus, and then here's our urinary bladder. So we're going to sweep through for pathology. No hairy scaries. So we're going to go where we kind of think this is generally the widest. So freeze our image there. So it's going to bring up my menu. It's ready for diameter 2. Let me save this real quick. So diameter 2, we're going to go across. Now if I were to measure across here, it'd be pretty wide. If I were to measure across here, it'd be pretty narrow. So we're going to kind of split the difference and just go in the middle.
Don't we have to clear the border on top at all? Or?
It doesn't fit. No.
Oh, okay.
We've swept it. So basically it is what it is.
Okay.
Out in the real world, we have that wide scan, and the the Philips has that wide scan where you can actually widen it and fit it. But in her case, we're just winging it.
Okay.
Okay, so there's diameter 2. I'm going to save him, and then it's going to bring up diameter 3. So this is going to be my AP. So again, if I measured here, pretty narrow, measured here, pretty deep. So we're going to kind of split the difference. Maybe go somewhere in the middle. 166 cc's. And a mil is the same as a cubic centimeter. So milliliter, they're interchangeable. So on your worksheet, sometimes they'll say mils, sometimes they'll say cc's. Okay, so let's look for some jets. So we're going to turn our color Doppler on. We're going to widen this, which I normally don't like to do, right? But we're not really sweeping. And if we go down, so here let me start at the top. So I'm at the superior, and I'm angling down towards that inferior, and we'll see, especially with very full bladders, you'll see these kind of little subtle little bumps on the bottom of the bladder, and that's where our trigone's at. And so that's where we're going to be hunting around. And so I just kind of sit on this for a few minutes, maybe just do a very small sweep through, but you don't want to be like, hey, where's this thing here? I don't know. So there's one right there. There's our root. Let's trace it down to the root. So there's our left. So left jet. How you guys feeling about that one so far? So we're just kind of walking our way down that bladder, just kind of hanging out, waiting for that thing to show up. There's left again. Okay, right. You're gonna get to doing your job here.
But the urinary bladder isn't part of our exam protocol, right?
No, but we're doing renals today, so
Okay.
it's part of a renal exam.
Okay.
So I just want to get you guys some background on it before we hit it really hard third quarter.
How many of both do you need?
Just one, but I figured. Oh.
Ooh.
And then there we have the right one coming up. So this would be bilat jets.
Why do they come in that later?
Oh, they just do. They make their own urine at their own pace. Okay, so there's our bilat jets. So then we're going to have our patient use the restroom. I'm going to lower you down. Please go ahead and use the restroom. Your bladder is very full, so I want you to go twice until you're totally empty. You got it. And then for annotation for this, we're just going to go Sag, UB, post void, which is PV. And then we'll wait for our patient to return, which is the longest waiting in the world.
What do you mean go twice?
Because sometimes they'll go, but they feel relief, and so they'll stop peeing, but they still have a residual volume. So I'm like, go twice, so that it's totally empty. Because it's not just a matter of like, you know how you've like had to go pee really bad, and then you go, and you're like, oh, I feel better. And like 10 minutes later, you're like, I gotta pee again.
Yeah.
It's because you didn't empty all the way.
So do you mean like she needs to sit on the toilet and try to like
Yes.
push it out,
Yep.
or come out here and then go
Nope.
back? Okay.
Push it out. Push it out. Done over there. We're just about done.
I'm trying to fill it up right now.
Oh, okay.
I'm not about to pee myself, so I feel like I'm not full.
And again, it's not that you're like super duper full. It's a matter of like what you can avoid. So that's kind of a big deal.
I just didn't know at what point you would be scanning, so I didn't want to like sit there for an hour.
I pee like every hour in the morning, so it's like
Maybe you scan first then. Or something, yeah. Oh yeah, here she comes. Hot stuff's coming back. Okay, so we have our annotation of Sag, UB, PV. Post void. Let's back up here. Okay. Alright. Coming in hot here. Alright, so in this case, we've got a little bit of a post void. So if I didn't have this, I would want to show this as my landmark, that cubic synthesis. But because we have a little bit of a post void, we're going to go ahead and measure what we have. So clear our diameters. This one we can probably just go kind of a straight across. So there's our first measurement.
that's the bladder.
Yep.
After you go back.
Yeah, it just got much smaller. And then we're going to switch to transverse. And it's a little teeny tiny guy. Bring up our diameter 2. This one's a little bit easier to measure than we had last time. And then diameter 3 is going to be our AP. Okay, so we went from 100 and something to 4.7. Are we happy? Yep, you got it. All right. So I'm going to lower you down. Go for it, people.